Well, welcome to day 21, and let's blame our parents. Look, even if you eat well, exercise, have a good cholesterol, your genetics could still alter your risk of heart attack. And when we talk about family history, we're talking young people, we're talking males, 55 years of age or less, who don't have a clear reason for having a heart attack early. Things like smoking, obesity, severe hypertension. When we're talking women about 60 years of age or younger, we're not talking great Uncle Bulgaria who had a stroke or a heart attack at 93, because that's not premature. So if you do have those sort of risk factors in the family, premature coronary disease, be aware, because there are risk factors that are worth checking, and sometimes we can't check them, so you just have to look. One of the things that we're most concerned about is a lipoprotein particle or a carrier of cholesterol called lipoprotein lowercase a, little a. This is probably the most significant genetic inherited risk that we know of. And if we find families with premature coronary artery disease or early coronary artery disease within the family, we will often check for LP little a. Currently, it's not covered by Medicare rebate in Australia, so you will be out of pocket probably $50 to $80 depending on where you get that done, but it's certainly well worthwhile. One of the other things that we often will do for people who don't appear to have traditional risks but yet have a family risk, because often the traditional risk calculators don't factor family risk very well, is we think about imaging the arteries of the heart, and a really good way to do that is a coronary artery calcium score. This could be done for men as low as 40 odd years of age, women as low as 50, particularly if there is a significant family history of early problems. Obviously, if there is a bad family history, avoid the traditional things like smoking. Do try and exercise well, do look after your diet. What's really important to know is that just because there's bad hearts in the family doesn't necessarily mean that's your destiny. Remember, if it's your mother or your father passing on the genes, you've only got a 50% chance of actually picking up the gene from them. My own practice and my preference is to look and see what's going on. So I get many people who have fairly unremarkable traditional risk factors. That's things like blood pressure, diabetes, absence, exercise, cholesterol levels. But I go on and I get imaging of the arteries done, and that really helps. So if we can then identify people who've got the gene and we know they're at risk, well, we can put strategies in place to make a huge difference. So remember, your family is not necessarily your destiny, though you can pick your friends, you can't pick your family. You are best playing the cards that you've been dealt, but trying to look at those cards beforehand. Till next time, I'm going to wish you the very best. I do hope you live as well as possible, for as long as possible. Take care, and bye for now.